Let's Achieve Change is a podcast by Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. My goal is to make you aware of various health and wellness topics. Every 2 weeks, Let's Achieve Change will appear with episodes with various topics with interviews and narratives, especially as it pertains to health and wellness and chronic pain and disabilities. I propose to be the voice for those silent sufferers out there. If you'd like to learn more about Let's Achieve Change or Metanoia Education and Wellness Center, please visit our website at changeachieve.com. Thank you. Hello. Thank you for joining me today on Let's Achieve Change. I'm Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. Listen, if you want to make some changes, you have tuned into the right podcast. Now listen, don't forget to hit that notification button so that you can subscribe and you won't miss any future episodes on some changes you might want to make. Hello listeners, so for the next 3 episodes, our conversation will center around 2 questions. One is, does timely intervention matter when we are hurt? And the second question would be, could post-traumatic arthritis be one of the reasons for chronic pain? So before I introduce my 2 guests for today, I want to just introduce a little bit of information about the Rice Principle, and also more information about post-traumatic arthritis. Okay, so let's talk about first the Rice Principle, and I'm talking about the rice that you eat. Okay, let's get that out there. All right, so Rice has an acronym of RICE. Okay, so R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. So, many times people go, and you probably can say that you've done the same. You go from time to time, you have injury, and you let it go for maybe a day, or maybe a week. You say, I'll go get better, and you let it keep going. And you maybe let it go for months and into years. But we find out that does have some consequences, okay? We want to at least talk about soft tissue injuries and what they are. Healing time for soft tissue injuries can vary, and it can often vary because of maybe occupation or overall health, maybe also too because of the type of activities we continue to do. Our age may have a factor, okay? But basically, there is a many type of treatments you might be able to do to start the process off in the healing process. So the Rice Principle is one principle that you can start with in the early stages. But what most people don't realize is that the Rice Principle can also be used without an expiration date, meaning that after maybe a few weeks, you may still have to do the Rice Principle. Okay, so let's deal with soft tissue injuries and figure out these are so important to acknowledge. Okay, so when we're dealing with soft tissue, we're dealing with muscles, ligaments, tendons, and they can take extended time to heal. As a matter of fact, the elastic and non-elastic collagen fibers that are injured may never grow back to the way they were before they were injured if they're not properly treated, and then we can be left with the lack of ability to perform to our body's fullest performance. Okay, let's talk about just a little bit about post-traumatic arthritis and what that is. So post-traumatic arthritis is basically we look at it as being a result of maybe some trauma or repetitive activity that occurred. It could be even years later or years ago, as when you were teens or when you were in your 20s. Maybe it was a type of athletics that you perform, or maybe a type of job duties you have, maybe in the military, or just even a regular public service job. Okay. But what we do know is that post-traumatic arthritis is often progressive. It's a condition at which the symptoms can be sporadic, demonstrating with pain, swelling, limited motion, and then if it's left untreated, it can become chronic. The statistics say that as many as 12% of osteoarthritis cases are due to post-traumatic arthritis, which can be from, like I said earlier, from injuries that happened 10 to 20 years earlier.
Okay, so before we bring on our guests today, I just want everyone to know that over the next 3 episodes, and we're going to try to deal with these subjects on delayed intervention and what would be proper timely intervention, as well as maybe some ways that we can reduce the incidence of post-traumatic osteoarthritis. Good afternoon. I am excited today to have Sarah on today. So first of all, I want to first, give thanks to Sarah. Sarah was served in the armed forces, so she is a vet, and we want to thank you for your services. And also too, I want to thank you for your bravery to be vulnerable, to come forth and tell your story at this time. The whole purpose of this series is to just try to educate the public and getting more of the stories out there, those who do suffer with chronic pain and disabilities, fatigue, and etc. And so we want to just hear a little bit more about you before we dive into the questions. As sometimes I may interrupt a little bit just to make sure that we stay on point, but I do want you to feel comfortable. Okay, so thank you so much for coming on. Thank you.
Thank you for having me.
Thank you. So, first of all, Sarah, can you just tell us, I know you said you was in the military, and at this point now, how old are you now, Sarah?
I'm 55.
So you're 55. So you went into the military about what age, do you know?
About 19.
About 19, and then you got out at about what age?
I think it's like 26, 27.
Okay. So while you were in the service, what type of duties did you have to do? Things that you had to do heavy lifting, or tell us kind of things you have to do in the military, while you were serving.
Yes, I went in as a supply specialist. So I worked in a warehouse, so there was lifting. I did all classes of material, anywhere from paper stocking to hazardous materials.
Okay. Now, did you remember experiencing any actual injuries that was treated while you were actually active on duty that was pertaining to pain that you have now?
Yes, I was having a lot of back pain and a lot of like all over pain, cervical pain, and wasn't for sure what the issues were. But I noticed that I did have a lot of pain.
Okay, and then you saw attention for that while you were there in the military?
Yes.
Okay, and what type of intervention did you receive in your interactions with that?
It was basically trying to manage the pain and see what the pain was, and to the point where it was actually why I got discharged, because I wasn't able to perform my job, because even out of a 30 days out of a month, there was some times where I wasn't even able to go to work because of the pain. It was just so severe, maybe 1.5 months.
Wow.
So I was discharged.
Wow. And that pain at that time was, you said maybe it was the neck and the back? Is that what you were thinking, or was it more places?
It was more places. It was all over pain.
Wow.
I couldn't walk, I couldn't function, I couldn't do anything.
Wow. And so, did they actually say to you that, it was a consensus that, it's time for you to be discharged, or how did that conversation come about?
Actually, it wasn't a conversation.
Okay.
I remember I was pregnant with my second child, which he's gone on to heaven now. I was pregnant with my second child.
I'm sorry to hear that.
And when I got out of the hospital, because I was diagnosed with cervical dysplasia, which is a precancerous thing, they treated that. But once I got out of the hospital, I realized that I had discharge papers.
Okay.
They had already started the discharge process. I didn't know anything about it. The only thing that stopped them was they couldn't do my financial checkout.
Wow.
And so they asked my husband, my ex-husband, he was my husband at the time, to do that, and that would stop the process, and that's how I found out about the process.
My God. Okay, I'm sorry to hear that. Okay, so here you go. You finally get discharged. You're having pain all over. At that point, did you have children when you got out?
Yes.
Okay.
I had two living, and I had the one that passed on. So.
Okay, so you were small children at that time.
Yes.
Okay. So now where do we go? We got small children. You're in pain. You've been discharged. So then, what do we do? Like, what do you do from that point on?
Well, I was married at the time. My ex-husband, he was in the military.
Okay.
And so that part was pretty much taken care of.
Okay.
Yes.
Okay. So, did you actually get a diagnosis at any point? You know, they know you had the pain all over, and you had the cervical dysplasia, and you had that treated. But did you ever get any other diagnoses from the time you had been discharged, and maybe a couple years after that, or when did that come about?
No, the only thing they said was what they really put in my chart was it was all in my head.
Wow.
They could not determine where the pain was coming from and why I was in such pain and why the medications and everything was not working. And so I found out that they had put in my chart that it was just in my head that I was feeling all of this pain.
And let me just interrupt and make sure the audience understands this, because this is what we're getting a lot. And I'm going to also mention that Sarah is of color, and we're not sure whether this is part of the issue, but we'll come back to this story a little bit later. We are seeing a lot of disparities when it comes to this issue as well. But what we want the audience to know today is that, you know, here we go, we having all these pain, and then we get a diagnosis of maybe psychosomatic kind of thing. And that's what's happening a lot as well. So we want to make sure the audience know about that, and know that that's not just unique to you. It's happening quite a bit. Okay. All right. So here we go. Now we got a diagnosis that is all in your head, supposedly. And so when do we go further down the road? Because I know you've had surgery. So how did we get to the point where we finally had surgery and got diagnosed with a possible herniation? How did that come about?
I had after a couple of surgeries, I had other medical issues going on. I had quite a few surgeries while I was in, but the diagnosis for my back, I had been having issues with my back, complaining about my back, hurting in my back. VA would never recognize it as anything, pretty much. It wasn't until I got out where it really got bad again. And then I went, and that's when I found out about my herniated disc, my cervical disc. All of my discs were basically pretty much unaligned.
So did they do an actual MRI?
They did.
Okay.
They did those in my record, but each time they would do a test, it would always come back, oh, there's nothing wrong. And that's the system of VA, because they always tell you there's nothing wrong. Or it's not that bad. Or it could be treated with ibuprofen. It could be treated with this, or it could be treated with that.
Okay, I got you.
And so we're not looking into why I have this and why it hurts like this.
Right. So who finally decided, who was the one that instigated to get the MRI and finally to say, okay, well, we have herniations and we need surgery? Who was it? Who was the responsible for that?
I went to it wasn't a military doctor, it was another doctor when I was having some issues, and we went in and we did the MRI, and that's when I found out, even to the point where when I got to the orthopedic surgeon, he looked at me and was like, I don't even understand how you're standing up.
Wow.
Because your back is so messed up. I don't even get in there at that point. I couldn't stand. I could barely walk, but I knew that I had to get to the appointment, and that's what started the ball rolling on. Something else was going on.
So you could barely walk, you could hardly stand, and you got small children.
Yes.
Okay.
Yes.
Yeah. And so, let's just tell the audience a little bit. I can only imagine how difficult that might have been for you, taking care of your children and pain like that. So can you just talk about a little bit of that?
Yes. I think the one thing that got me through is holding on to my faith.
Man, good.
And knowing that this too is going to pass.
Amen.
No matter how hard it is, I can make it through it as long as I keep God first.
Okay, great.
And that was the way that I positioned myself, because one of the other things they would say is, well, you were depressed because of your pain, but your pain causes your depression. And so when you have to function, you have to take care of children. Even going through that, you have to find ways to do it, to the point where I had to teach my children at a very young age on how to basically survive by themselves.
Yeah.
And how I had to keep things in the house that it was easily accessible for them to eat and everything. And not only that, but them trying to take care of me. and
Wow.
bring me
Yeah.
water and food and things that I
Wow.
need.
Yeah.
Whereas a lot of times I could not get that because, again, I had small children.
Wow. Wow.
And
Wow.
by that time, I was raising them on my own
Wow. Oh my God.
because
Yeah.
I was divorcing from my ex-husband.
Yeah. Yeah. Wow. I'm so sorry to hear that. That's yeah. That's a lot. That's a lot. That's a lot. So now, when did we actually have the first surgery for the neck or the back? When did that happen?
I believe that was in 2020, I believe.
Okay.
When
Okay.
I had different, like, cortisone shots, infusion, but I did not have the actual surgery until
Yeah.
then.
Yeah. They were trying to treat it symptomatically with injections and all that.
They were always doing the,
Yeah.
yes,
Yeah. Trying to patch
treating
it.
the symptoms, and
Right.
that's the
Right.
problem.
Right. And so we'll come back to the surgery, but let's go back a little bit. So did you have therapy through this process? Physical therapy or even psychological counseling? Because you mentioned you also was depressed and you're very fatigued and you had to deal with the children. Did you have any counseling and did you have physical therapy as well? In those interventions?
Yes, I had them both. I had physical therapy, and I also did counseling as well because it's very difficult. I mean, when you're dealing with pain and you're dealing with medical issues, it takes a toll on your mind.
Oh, definitely so. Oh, definitely so. Definitely so. Definitely so. So, how effective do you think the physical therapy and the psychological therapy was for you?
Well, the psychological you had to do not only with them, but as well as with yourself. Because when you think about the VA system, the VA is a how can I say it properly? VA is a system who is not relying upon God's word.
Yeah. Yeah.
They're relying upon, and so by me being a Christian, I had to also have Christian counseling as well to help me do that and make sure that my faith was strong. And I did have physical strengthening and stuff like that, but I had to fight to even get that.
Wow. So you had to request it. You had to make sure that you got that service.
Yes.
Wow, that's interesting. Okay, that's interesting.
And it wasn't an easy fight to request it to say, because again, they had put in the chart that this was all in my head, and so they were thinking, no, I don't. This was a waste of time, resources, and efforts when I knew that was something that I needed within my body. Because again, you've only known me for a short period of time that you've examined me, but I've known my body. For all the years that I've been in it.
Yeah. We call that term gaslighting, and that's going to be also brought out a lot. That's sort of a. Have you ever heard of that term, gaslighting?
Yes.
Yeah.
Yes.
And so it's more of a dismissive attitude. My conclusion is that it's often done when people don't believe you, or when or if they just think that, like you said, like, I don't know what else. They don't know what else to do, and so that's their answer is to dismiss it. So, okay. So now, we get to the point where we are quite sure we're on medication for the depression and the pain ongoing, and so we had the surgeries like 2002. You had those first?
I think it was 2020, because it was about
2020.
About 4 years ago. Yes.
Okay, 2020. So that was the first surgery for the spine, correct?
Yes.
Okay, I got you. Up to that point, they would get like injections and that kind of thing. Okay. Yes. So was it a private orthopedic surgeon that performed the surgery, or was it VA surgeon?
Private.
It was private. Okay. So how did that go? How did you think that system worked for you? Give me some input on that.
That went actually very well.
Okay.
Once I had it, because it was so much pain for so many years. After I did have a relief for about 1 or 2 years.
Okay.
So I'm not. I wish that option was there earlier.
Yeah.
Because it did give me a relief, but now I'm having issues with it again. But at least I did get that relief from it. So I think the surgery was successful.
Okay, great. So you say you have plates that was considered to be a fusion type of thing. So with that being said, you said you had good results for that for a couple of years. I'm assuming you had therapy after that surgery. Is that correct?
Yes.
Okay, good. That sounds good. All right, so now we finished with the private orthopedic surgeon. He finally discharged you, I would assume, correct?
Yes.
Okay. All right, so when he discharged you, you were pretty stable. You were doing pretty well. And then you started having, you said more pain started coming about again. Is that what you're saying? Okay.
Yes.
And so then what do you do at that point? This is like maybe a couple years down the road, like maybe 2022 or 23, something like that. Yeah. So when did the fibromyalgia, I've noticed in your chart here your fibromyalgia, when was that thrown in there? Do you remember when that diagnosis came about?
That was before I even got out the military.
Okay, I got you.
Because when you think about fibromyalgia, that's one of those terms that they throw out there for pain that they can't explain.
Oh yeah, definitely so. I'm just trying to make sure I got the piece of the puzzle. Oh, for sure. Oh, no, most definitely so. I've been in the field a long time. I know what the diagnosis that usually come out of that. But I'm just trying to make sure I got that correct. You know, the chronic fatigue and the depression and the fibromyalgia when it all came about. Okay, now we're like maybe a couple years ago. We're having pain. You're still dealing with the fatigue. Of course, your kids are older now, so thank God for that. You got them through those years. But you know, I guess the major thing I want to get across to the public is that you've endured years. You know, years of struggle. You know what I'm saying? I mean, and as you mentioned, thank God for your faith, because you know that's what pulled you through all those years. You know. So you know, if you had to possibly, you know, somebody gave you the authority. They said, Sarah, you get to make some suggestions here. You get to make some recommendations here based on your story, based on what you've gone through. What would be some of the things that you would recommend? Or would you even say, whether it was to the medical professionals, maybe to your family, maybe to your peers? What are some of the things that you would say out there?
I would say keep holding on to your faith. This too shall pass. It's only yet for a moment. Your moment may be like mine was. It's 34 years and counting, but it's still yet for a moment. And then standing firm when you go to your doctors and not taking no for an answer.
I got that. Yeah, I got that.
Not taking that this is in your head. Not taking that this doesn't hurt that bad just because you walked into the office, just because you was able to come into the office, just because you were able to do certain things. But just not taking no for an answer and realizing that, you know, that if you feel there's something wrong within your body, then there's something wrong.
Yeah, exactly. I like that. So if I had to put an epitaph out there, I'm asking this question quite a bit on your tombstone, and I'm kind of getting what I'm thinking it is, but because this is going to be the title of your chapter. But to sum up, if someone heard that and they would say that sounds like Sarah. Like, for example, my brother's going on to heaven now, and he will often say, he had a chronic pain or autoimmune disorder as well, and he would often say, you know, grace and peace, dear ones, and he would say, it's nice to be nice. That was him. So when you heard that, you knew that was him. Okay. So what would you think would sum up you? What would be what you would say to sum up you?
I have quite a few aspects that I would say, but one of the things is this too shall pass.
This too shall
pass. And the other one would be I respect my pain, but I don't bow down to it.
I like that. So this too shall pass. I respect my pain, but I will not bow down to it. Okay, I like that quite a bit. Anything else you want to bring about or mention? Do you think as if there's something else you want to share?
Yes, I think one of the things that a lot of people, because I have had the pain and the chronic fatigue, which I go through a battle of having a lot of pain, and then my body has a chronic fatigue connected to it, and people don't understand that part about it, because once your body go through a lot of pain, your body is fighting, so it gets weak.
Yeah.
And that's where the chronic fatigue comes in. But you're living in a cycle.
Yes.
Of pain, chronic fatigue, pain. And you're going back and forth, or realizing it's okay not to be okay.
Yeah, I like that too. Yeah, I like that too. So, do you feel as if you're responsible sometimes for your pain? Because you said it's a cycle. So, do you feel sometimes you bring about the pain and things that you may do?
you can re-injure if you're not careful and not paying attention to your body
Mm-hmm.
and not
Mm-hmm.
paying attention and making adjustments to what you have to adjust to.
Mm-hmm.
I've learned over the years, even in my home, I set up things where I have to make my home adjustable to what I'm going through.
Mm-hmm. Mm-hmm.
And so if you don't do that and you're not careful, some other things here, you will injure sometimes. And
Mm-hmm.
you go back and be like, oh, I turned wrong.
Mm-hmm.
That's
Yeah.
what did it.
Yeah.
Knowing that one simple turn, like one simple turn in your car to look back.
Right.
It can
Right.
be what was happening with me. It will pop. I would actually hear a pop.
Wow.
And I
Wow.
would know, okay, I can't do that. But
Mhm.
really just paying attention to what you were doing.
Exactly. Sounds, yeah, that's true. That's very true. Very true. Okay, I think we're going to sum up everything. I really appreciate you. I'm so sorry what you're going through. I really am. And but I'm so grateful that you're willing to share it, because I do feel it's going to make a difference. I really do. I believe that about my heart. And once again, I do want to thank you for your service. And that'll be it for now. We'll be back in touch with you. I know you have a lot more to share, but we're going to have to end for today. I thank you, Sarah. Have a blessed one,
One of the
okay?
things I would say
Yes,
is
ma'am.
never feeling sorry for me in the things I go through. I understand the language of it, but this is my destiny. This is what I have to do
I hear you.
for a time such as this.
I hear you. I hear you. I hear you. Thank you for that correction. Okay. All right. Thank you. Have a blessed day. Okay? All right.
Thank you
Okay.
so
Thank you.
much.
Bye-bye. Bye-bye. Bye-bye.
We have Charles here, and I'm so excited to talk to Charles finally. We've been trying to meet with him for a while, and Charles has also a very unique story. The purpose of all this is to allow the public to get more aware of the chronic pain and disability situation that many people face in this country, and so we can kind of maybe bring some more awareness and hopefully make some changes in some of these systems that need to be improved upon. Okay, so first of all, Charles, I'm going to say thank you. Thank you for being here.
All right.
So the first thing, Charles, can you please tell us, I know you was not having problems with chronic pain all of your life, so can you kind of just give us a little bit of a summary of when you started having problems, and what type of background you came from that may have started all your chronic pain problems?
Okay, well, I joined the U.S. Air Force in 1999,
Okay.
and from there I trained to work on aircrafts,
Okay.
and I ended up being shipped overseas
Mm-hmm.
to Europe, and from there I was working on a lot of fighter jets and heavy aircrafts, which is a lot of metal,
Okay.
a lot of steel.
Okay.
And I believe it's where I started contracting a lot of my chronic pain issues because of the weight of a lot of the equipment
Yeah.
and aircraft parts that I was working with, and being young and dumb, trying to prove a point and
Yeah.
moving and carrying this stuff by myself,
Yeah.
which I was finding out was taking 2 and 3 man teams, and I was doing
Wow.
I was doing it alone.
Wow. Wow. Yeah. Yeah. So that's crazy, and I know many people can speak about that, which is crazy. But first, I want to thank you for your service to our country. But you suffer from that tremendously. So where are you having most of your pain? What area of the body?
The knees, the shoulders, the mid back, and the hips.
Wow.
A lot of worse.
So
More so the neck and the mid back is the absolute worst.
okay. So did you actually have to do any type of surgeries, or did you have any particular injuries that was also gone down on your diagnoses at all?
Well, in the beginning, all they kept doing was, it's a sprain therapy, and we'll give you pain management.
Mm-hmm.
So they was shooting me up with these drugs
Mm-hmm.
to basically numb out the pain, and
Mm-hmm.
in return, what it was doing was it was making me feel like the Incredible Hulk, and I was doing even more stupid stuff.
Wow.
Making it worse.
Yeah.
Yeah, like these aircraft parts, we had someone was weighing like a slat, weigh anywhere from 250 pounds to 320 pounds.
Wow.
And I was picking these things up by myself on my back, carrying it into the shop.
Crazy. Oh my God, that's crazy. That's crazy. So did they actually, you said it was calling it strains and sprains and everything, so did we ever get any other diagnosis other than the strains and the sprains?
Years later,
Okay.
I got diagnosed with degenerative disease, and when I researched it, I realized that came from the military because they were giving me so many shots that the cortisol started deteriorating my joints.
Yeah, exactly. Yeah, that's very much in the records for sure. Okay. So, did you have to have any surgeries at all in any of the joints?
I ended up having to have knee surgery first because I tore my ACL, my meniscus, and cracked my kneecap.
Wow.
And from there, I had to have one day my back tried to go out, and when they researched it, they couldn't find it, but I had chronic pain, so then I had to have ablation surgery.
Wow.
Where they went in and cut the nerves, and that only lasted for about maybe 6 to 8 months.
Yeah.
And that came back. He said that the hip had fused.
Wow.
So I couldn't bend over and pick up nothing. And being military, you just learn to adjust. And also used to being in pain.
Yeah.
And I didn't realize that it was getting that bad.
Right.
And I would just adapt.
Yeah.
So I would find other ways to still do what I needed to do.
Yeah. Yeah.
And it was funny because what made me realize when it was bad was one day I had to change the tire on one of the cars because the tire was flat. And I couldn't get down to change the tire, so I ended up laying on the ground to jack the car up,
Oh my
to
goodness.
change the tire. So then my neighbors were running over because they thought something was wrong. And the issue was that was the only way that I could get down on the ground to take the tire off.
My goodness. And Charles, let's get your age. What's your actual age at this point?
I'm currently 46 years old.
And you started in 1999 when you were starting to do all this. How old were you at the time?
22.
So you figure it's already like 24, at least 24 years of this, okay? Oh, wow,
Yes.
Okay. So at this point, we know now that a lot of this came about from definitely degenerative wear and tear. A lot of things that you was trying to be heroic and trying to do your duty and went over beyond, of course.
Yeah.
So we don't want to get into a whole lot of things because it would take us forever with this. And like I said, this is going to be one of the first books just to get people educated, and then the second book will go into more other systems. But can you answer this question, though? Do you feel as if the traditional medical model has helped you or hurt you as far as, I don't know if you ever heard the term gaslighting. Are you familiar with that term at all?
Yes, I am.
Okay. So, do you think as if you've had any problems with the traditional medical model in caring for you, or do you think they have been dismissive with you? Can you speak on that at all?
Yes, I feel like the system from the beginning has really let us down, and it's gotten even worse because the difference that actually changed that was helpful was people like you that actually understood and knew what was the problem.
Right.
Not generally diagnosed it based on textbook, and
Yeah.
even now it's worse. It's computerized.
Yeah.
So you're looking at, well, he said this is the problem, so this is the general issue, so this is how we treat it.
Yeah. And I don't want to bring up too much, but I do want to bring up enough so people understand, because the audience has to understand some of these things. Can you speak of some places, and don't say any particular names, but what are some of the way they approached you, or even in the VA system? What are some of the things they recommended, or some things they approached you with to try to help you, other than the drugs? I know the drugs was one. What else?
That was immediate, and the BS therapy.
Yeah.
Their therapy system is a joke.
Yeah. And
Therapy is not, oh, this is what your problem is. Here go a piece of paper, follow this paper.
Wow.
What?
Wow. Yeah. Okay. All right. Yeah, we're gonna have to address that too at some point. Okay. So basically, you've dealt with all this. You're still struggling, and now you're trying to. Have you gone to the disability process at all? Trying to get disability?
Yes.
Okay.
And I have been fighting for disability since 2010.
Wow.
And I got it granted. And then during COVID, they took it back.
Why?
Explain to me. I have no idea. So I had to just go ahead and just go get disability lawyers and lawyer up.
Yeah.
And had to have lawyers fight it.
Wow.
And got it overturned in 2021.
Okay.
From since 2010. So
wow, 11 years.
Yeah.
Did they do any retroactive for you?
They did, but they found ways to cut it.
Wow.
I mean, it's BS. It's just, they use language that you can't understand, but they came up with excuses, basically, so I ended up getting retro for maybe like a year or two.
Goodness gracious. So, if you had to tell people, like, based on what you have, you told us already to get down to change your tire, you have to get on the ground and lay down. Can you tell us anything else that you had to change in your lifestyle to handle how you had to deal with your pain? Because most people take it for granted. They don't think, well, no big deal. People can get on the ground and change a tire. So what else do you have to, and you're a little small child as well, so do you have to do anything differently to try to keep managing yourself?
Yeah, I had to learn to strengthen my upper body tremendously to suffice with basically almost losing the normal operation of my lower body. Wow. So my upper body became my best friend, because that ended up helping me do basic stuff to lift myself up off a toilet, to hold on to things, because if I fall, I was in trouble. So I had to make sure my upper body was strong enough to pull myself up.
Wow. So does it take you a while to, to put on your pants or to tie shoes or to do anything in the lower half, since the lower half is a problem?
Oh, yeah. It's most of the time I just wear slides or something, because it's almost impossible to tie my shoes.
Wow.
It hurts too bad.
Yeah.
It hurts way too bad.
Yeah, just to make that bend over and reach up and pull those. Yeah. Wow. I'm sorry for that. Really, I'm sorry for that. So if you could tell us, like, maybe if there was something that you can give us, some type of suggestion. If somebody said, Charles, we're gonna give you the opportunity to make the changes in the system, what would you say to some people? What would be some of the suggestions you would make based on what you've gone through?
One, based off the top with authority. The people that are dealing with vets and people with pain issues need to make sure that they're thoroughly qualified.
Okay.
And not just basic textbook, because it's kind of like when I worked on fighter jets. They said that this is the basic instructions you needed to work on an aircraft, but your job is tremendously special based on everybody else's job, because your job is a diagnosis. When there's problems, there's no textbooks to fix the problem.
Exactly.
You have to know the basics, and then from there work out how the repair needs to be done. And that's kind of the same, I feel like, with our pains in the body and stuff. But you need to know the body first, because it ain't gonna be the same for everybody.
Exactly.
It's gonna be something different.
Exactly. So I'm going to try to sum up. Let me know if I'm misspeaking, because I'm trying to make sure the audience understand. So basically what I'm hearing Charles say at this point is, you got people coming to be in a position where they're making a decision on someone's life here, and they don't know enough about chronic pain to make that type of decision. And so you think that's one of the biggest steps is for them to have people who are more qualified in that area. Is that correct?
Definitely.
Yeah. Okay.
Because my degenerative disease did not come from my lifestyle. My degenerative disease came from people over-treating me and not understanding my condition.
Okay, that makes a lot of sense. So if you had to, and I'm asking this question sounds kind of morbid, but this is a very good question, I think. If you had to put an epitaph on your tombstone, and this would be something people will remember you by. They hear this, they say this, it represents Charles. For example, my brother, he's gone on, and he will always say, grace and peace, dear one. So it's just nice to be nice. You heard that, you knew that was my brother. What would be yours? What would be your epitaph?
Probably more of the lines is, here lies a person, Charles, that was always with a big heart, willing to help anybody and everybody, regardless of the circumstances and his physical capabilities.
Okay, so I'm going to make sure I get this down right, because that's you saying a whole lot in a lot of sense. So because I got this is going to be your chapter. Okay, I don't want to make sure I misrepresent you. So Charles was one who was willing to go beyond and help others despite what his physical disabilities were. Pretty much, that would be saying.
Correct.
So Charles with the big heart compromising his own body to help others. That's what it sounds like. That's what it sounds like. That's what it sounds like. Anything else you want to leave with the audience? Anything you want to share? I'm so grateful. Anything else you want to share or you want to leave? Any thoughts?
I'd suggest to everybody out there that when it comes to your body, make sure you research for yourself and make sure you understand what they're saying and trying to diagnose you with, so that you know and you have a record of yourself, so you're not lost when they start saying things and they start treating you. Because if you're not aware of what they're treating, they could be treating you for the wrong thing.
Right. And I'm hoping at this point too that you're on an exercise regimen to keep yourself going, because that's one of the things, just from what I know about you, that you have to continue to do. So stay encouraged. Don't I hear you have a big heart and you're helping others, but I want you to make sure that you're still doing things to make sure you keep yourself going. Okay? Please do that. Thank you so much, Charles. Thank you so much. Okay? And I'll be in touch.
Thank you for all your help, because you were a big change in my life with my physical condition, whether you realize it or not.
Thank you. I appreciate that. That feels good. Have a blessed day. Okay? Continue to go on. Okay. Bye now. Bye. So as I was mentioning, we need to dive into more of the statistics next episode to address some of more of the studies that are dealing with post-traumatic osteoarthritis, especially as it pertains to heavy years of wear and tear on the bodies from services like in the military or athletics. And so since we're dealing with Sarah and Charles, we're going to stay basically with the from the military perspective in the VA at this time. Also, we want to make sure that we understand the other topic that Charles brought up is about the long-term use of steroids. The facts are out there that long-term use of steroids can cause deterioration of our bone structures. So I would like to dive into that a little bit more on the next episode as well. I'm going to conclude this episode dealing with more about the Rice Principle. And this is important because I think people who have a misunderstanding of the Rice Principle, they feel that means something that you only do early intervention. But this is something that, like I mentioned in my earlier statement, it's no expiration to this. So, for example, for the R stands for resting. Well, we don't understand what that means most of the time when we say resting. Well, for a neck and a back, when we're all walking around all day long and when we're doing activities, gravitational pulls or stresses are being placed on our bodies constantly. So those structures are not resting. Okay. So how can the area heal if it's not resting? So if you then attach just our normal, walking around and doing our normal daily activities, and then now you place extra lifting on that situation or repetitive tasks of a push-pull lift, it's not resting. So how can we expect it to heal? It won't, okay? So that's something that needs to be addressed. It's not being applied when we're saying, okay, now these people have been injured and let's now get them to heal. But that's not been applied. And then when we talk about the other portion of RICE on the acronym for E means elevation, or it simply means taking the weight off the area. So here we go again. Are we taking weight off the neck and the back? Are we taking weight off the legs if we're still up around doing things? If we're doing all our daily activities, are we continuing to do our job duties that are stressful and repetitive? No. Okay? So this is something else that's not being addressed. So we need to also conclude that, yes, the improper interventions, so the untimeliness of the intervention, and yes, the improper intervention, all are contributing to the degeneration process, the wear and tear on the structures, whether it be the tissues or ligaments, as well as the progression of the chronic pain complaints. As you heard Charles and Sarah both mention, how it came back. It came back. Well, no, it came back because why? They continue to do things that no one trained them not to do. They continue to have to do life, and nobody gave them options of how not to do some things. So I thank you so much for tuning in to Charles and Sarah today. As I mentioned, I want you to stay tuned to next week next episode, which will be in 2 weeks, because we're going to dive into more about post traumatic osteoarthritis and the long-term use of steroids.
Thank you for tuning in today at Let's Achieve Change. Don't forget to like, share, and subscribe. You will find out more about Metanoia Education and Wellness Center on our website at changeachieve.com. We welcome your questions and your feedback. Please feel free to fill out the form on the website and we will contact you directly. I pray that you prosper and be in good health, even as your soul prospers. Remember, it's all about the change. Thank you.